And what we do in terms of recruiting lay health workers is we use the Chinese media in San Francisco, newspaper, radio, television stations. We submit press release to these media, and they will help us announce our project and that we're recruiting lay health workers. And we also recruit through other CBOs in our neighborhoods. We have sent flyers to organizations that are affiliated to us, and just the rest is just by word of mouth from people that we've worked with in the past, and past lay health workers also refer new lay health workers when we are recruiting for another wave. So those are the main channels we recruit our lay health workers. I would say the most effective way for us is mainly through other CBO referrals, because they are already connected to all these people in the community. A lot of our lay health workers get services from these CBOs, and then they hear about our project, and they happen to be interested in health. So when they hear about the project, they come to us and want to become one of our lay health workers. In general, each wave, there are 4 waves altogether in this project, and each wave, after we send out our flyers, announcements, we will receive about an average of about 80 to 100 inquiries from interested people who wants to participate in our project. And so actually getting the word out is not the hardest part, because it's relatively easy for people to hear about the project, and we do get a lot of responses after we publicize our project. The harder part is finding the right candidates. So we usually go through a process of phone screening. When they hear about the project, they usually would call our office, and we'll talk to them on the phone, explain to them about our project. And after they learn more about the project, some are not so interested anymore, but some people are still interested, then we'll go through a screening of eligibility, because there are certain criteria that they need to meet in order to participate in the project. And after they've met all the eligibility criteria, and if they're still interested, then we schedule an in-person interview with them, because we feel like doing this kind of lay health worker work, the personality really plays a big role in the work that they do. They need to be personable. They need to know how to talk to people, and that kind of stuff. So we feel like an in-person interview is important, so that we can get a feel of what the person is like and talk to them more in depth about the project. And then after interviewing maybe about 40 people each way, we will find 12 to 16 good candidates, which would eventually become our lay health workers. I feel like it's hard to find the right candidates, because there are a number of criteria they need to meet. First of all, they need to meet all the eligibility criteria set by the researchers, like their age. They need to be San Francisco residents. They need to, and then the second thing is the time commitment, because our project actually requires about a year of commitment. From the time they join the project, starting the training, until the end of the project, it takes about a year. So that time commitment sometimes could be a barrier for some people. And also they need to be able to have a large social network, because we really depend, for our project, we depend on the lay health workers to recruit their own participants. Our idea is for these lay health workers to reach out to their own friends and families, co-workers, relatives, people that they are already in contact with in general, and invite them to participate in this project. So it's important that the lay health workers have a large social network, so they can actually find interested participants to come to their sessions to learn about colon cancer. And also they need to be able to make it to our training dates, because we have a few days of training that they need to attend before they go out and teach people about colon cancer. And sometimes, because we're working with a lot of very busy trainers, it's hard to get everybody's schedule together. So there would be times when we find a really good candidate, but because they really couldn't make it to those training dates, then we have to give them up and find somebody else. So those are some of the barriers to finding a good lay health worker that I can think of right now.
Yeah, okay. I'm really curious about your LHW workers. Are they mainly volunteers, or do you give compensation to correspondees to the work?
Yeah, our lab workers actually get compensated for their time. So like I said, the time commitment is about a year with maybe around 30 to 40 hours of work. And we do pay them $1,000 for the completion of the project.
When we do the actual recruitment, we actually downplay the stipend part, so most of our flyers won't even mention the stipend. That way we get people who are just genuinely interested in going through the training and learning and being these volunteers for us.
So the training, this is important because I think, we can't just recruit them and set them loose. You got to teach them what they need to know. And so I'm going to turn over to Elaine and actually Lee Chen and Jing, all three of you, to talk about the training.
You go ahead. You are the principal.
We all acquired names after 4 years of working together. So Ching is the one actually, Ching is one of the trainer, and then Elaine and myself and Janice also. And so
Ask the doctor.
Yeah, ask the doctor, because Ching is known as the doctor.
Practicing with a license.
Okay, so the training session for the intervention arm, of course we don't call them the intervention arm, we just call them the lay health workers who's doing the colon cancer prevention side. And we actually have developed 2 training manuals, and one is called the orientation training. And this orientation training actually is for both the intervention arm and the control arm. And we gave them like a 4-hour training. Basically, that training consists of what is randomization, what is research. We want to inform the community about this is a research study, and then the participants, whoever you recruit, are going to follow you. They will be randomized into either a CRC, which is colon cancer prevention arm, or the nutrition arm. So they were told right at the beginning. So I think we learned something in the process of how to educate the community on what is research and what is randomization. So I think we went through a lot of discussion right at the beginning with I guess I'm from the community side, and how to how to work together as a team to bring out the topic in a very simplistic way to tell the community that it is a study. And so Ching, you want to say anything on that?
Basically, the randomization in every class, the population is not just the Chinese, but also Vietnamese and other population as well. So the only way we can explain to them is just people who understand their culture, what does that mean, and then pick something live example, and then use that example as a randomization, and they answer your question, and they realize that is randomization, why they will have control and intervention. That's how we do it. Rather than the straightforward sign language, they don't understand anything.
Yeah, we actually thought of many scenarios.
Right.
We all remember 4 years ago.
The simple thing
what
is
would be the simplest way to inform the community being randomized?
Right. 2 part of plant, one with fertilizer, one without. That's it. Simple like that.
Yeah.
And
We
you
went
can see
through
it.
that, but we didn't pick that one.
I know, but we pick a better one. Even that simple, we still have better ones.
Yeah, because I think the example that we had before was from the Vietnamese community, and then I think the Vietnamese community have more of a agricultural background.
We had farming examples.
Yeah, they use farming
It didn't work.
examples. Right. So when they come to the Chinese immigrant population, not that many of them are from the farming background. So we were saying, oh, I don't think we will work, So then I think we then kind of from discussion and talking, we actually came up with a very simple one, which is it? Which one are we using as
We don't know,
because
but in the program.
I think we end up using is like picking a number from a hat. Like it's equal chance. So it can be a hat, and it can be then become a computer because the computer generated. Jen, I'm looking at Jen because Jen is the one who put their names into the computer, and then we even as trainers do not know which arm are they being randomized to. So so like the computer would generate which member. Like Elaine started with the recruitment, right, and then she came up with all the chosen lay health workers, and then the names are put into like a hat and like a computer, and then so because in Chinese randomization we actually translate it as computer generated. Yeah, you know, 電腦分配, because the computer would tell us, oh, you are in this team, you're in that team. That seems to be simple enough for the community to understand. So this is the first part when we do the 4-hour training on randomization and research. And they were done by already randomized into the 2 arms already. We trained the first 6 or 8 lay health workers who are in the CRC arm, but we actually don't know which arm they are in as a trainer. And then the next day, another will be trained, and they are the control arm, for example. Yeah, on the same thing. Yeah.
And recruitment, they're also trained on recruitment.
Oh, that's right.
So when they go out and recruit, they don't know which group they're in. So it's not that they can use that information to say, I'm teaching about colorectal cancer, will you participate in this study? Or I'm teaching about nutrition. They are actually blinded. They don't know which group they're in until they finish recruiting all their participants.
Yeah, so for both the lay health worker and the participants that they recruit, they do have to agree. Whichever arm that you are being computer generated to, you have to agree.
You mean the
lay health workers.
The lay health worker
And then the
people?
participants are
Yeah.
basically follow the lay health worker. If the lay health worker was randomized into the intervention, then all her 15 participants will be in that in the
Randomizing.
right.
So Elaine, when you were recruiting, were you also telling them that they were being recruited into a research project?
Yes, they do, yeah. And actually, all the lay health workers are also considered a research subject. They need to sign their informed consent, yeah.
Were there any critiques about the relatively low compensation, either from the community or from reviewers when you put your grant out? I sit on a review panel, and there's increasingly more trends towards equitable budgeting and transparent budgeting and making sure that enough money. And it's actually very difficult to do. So I'm always just interested in hearing how people address that.
From review, we didn't get anything about the money. No one said we spent too much or too little. At least on the lay health worker you're talking about.
And how about in the community? Did people say, you want me to do all this for free?
You know what? I don't think people would think that's too little. Most of the people think it's a lot of money for the work that they're doing, because they're already interested in learning more about health. So they really see that I'm here to learn all these things and I'm getting paid to do it. They really find it like a great deal.
Yeah.
That's really a testament to how much they trust you all. I mean, it's fantastic that you get such a positive.
Yeah, one thing that we haven't talked about is what happened at the end. And what happens at the end, at least in all other projects, and we can speak to the Chinese, the lay health workers really love their experience. Because they learned something new, they learned some new skills, they did things they thought they couldn't do, and so they get more compensated than just the money. The money, I think, is nice. It works out to be like, what, $1,000 for about 30 to 40 hours worth of work. So it's not minimum wage exactly, but it's not lots of money.
Yeah.
But they seem to be okay.